Medicare has 4 parts, a dozen confusing terms, and somehow no one has probably ever given you a very clear explanation on any of it. But that's what this video is going to be. So, if you will, for the next 10 to 12 minutes, if you would give me just a few moments of your time, I will explain all of the parts A, B, C, and D to you in plain English, no jargon, no sales pitch, no fluff, no pressure. By the way, my name is Joel. I'm a software engineer and a licensed Medicare educator, agent, if you will. I know that's a weird combination, but that combination helps me explain really complicated stuff as if it were really, really simple. So let's start with Part A, and that's your hospital stays and all that kind of stuff wrapped in one little package. Inpatient hospital stays, skilled nursing, hospice, some home health. And here's the good news for Part A. Most people pay absolutely nothing for Part A because you were paying into it the entire time that you were working. Now, it's not totally free of cost when you use it. There are some deductibles, but in terms of a monthly premium, usually that's taken care of. So, in a nutshell, Part A equals hospital. Got that? Let's move on. So, Part B equals your medical expenses or your medical insurance specifically, like your doctor's office, specialist visits, and all of the regular everyday stuff. Outpatient visits, lab tests, all that kind of stuff is wrapped up inside of this package in Part B. Now, Part B does have a monthly premium that at the time of recording this video, monthly, that is $202.90. But the good news here is that for most folks, you can have that taken directly from your social security check, so you don't ever really have to worry about it. So as a rule of thumb here to keep this in mind, this number does go up with inflation usually. So when your social security check does get a raise, so does this number. Now, Part A and Part B together sum up to create original Medicare. Now, knowing that is the foundation and everything else builds on top of that. So hopefully we're good here. Hopefully now we can move on to Part C. Still with me? Good. Let's move on. Okay, so now that we have original Medicare pretty much at a basis level, that's where we will start in terms of building on top of this. So let's move on to Part D. Now, I know this might seem a little bit out of order, but there's a reason for that because Part D is your prescription drug coverage. Original Medicare, like we talked about before, doesn't actually have a prescription drug plan attached to it. We usually have to do that separately if you only have original Medicare, and that is done with a Part D or a Part D plan, and it's only used as a prescription drug plan. Now, the thing to understand here is that Part D plans are given to you through private health plans or private insurers. So that's not given through original Medicare. It's a separate entity all by itself. But the main thing to understand here is Part D equals prescriptions. Good? Okay, let's move on. Now, the next piece of this is Part C, and that is known as Medicare-Advantage. Now, for most folks, this is where things get really confusing. So I'm going to slow down here and take my time and explain this so that it makes sense. Part C isn't a new benefit. It's a different way to receive Part A, B, and D in one package. So in total, you're usually choosing between two different roads, either going with original Medicare or going with Medicare-Advantage. Now, if you decide to go with just the original Medicare, most of the time, or really all of the time, you're going to need to pair that with a prescription drug plan, which is a Part D plan. Or you can also go with a Medigap plan, which is going to cover everything that original Medicare doesn't. But that said, it will have a little bit more of a cost if you go the Medigap route. Or you can go with Medicare Advantage, and that again has Part A, B, and D wrapped inside of it. So you have your prescription drug plan, your Medicare expenses or medical expenses, and your hospital expenses all inside of one package, but it does have a network usually associated with those. And that network has its own pros and cons in terms of what you have available to you and what you don't, in terms of doctors, hospitals, networks, all that kind of stuff. So if you want more freedom, then you probably want to go with original Medicare, then add on a Part D or Medigap plan. And if cost matters more to you, then a Medicare-Advantage plan is probably the best place to start. But here's the part that I really don't want you to miss: the timing, because you get a 7-month window around your 65th birthday to actually elect and sign up for all of these things. 3 months before, the month of, and 3 months after your birthday. If you do miss this window and you don't have qualifying coverage, you can and will get a penalty that is lifelong and will creep up the entirety of your stay inside of Medicare. So my advice to you is, if you are turning 65 soon, at the very least, make sure that you have qualifying coverage and a prescription drug plan that actually qualifies as coverage as well. But that's the whole map. That's the entire thing from start to finish. Hopefully this makes a little bit more clear sense and gives you more ammo to actually make an informed decision. If you need some help and you want a clear, unbiased opinion on what you should do for your life, that's why I'm here. So if you could do me a favor and send this to someone that you feel might be a little overwhelmed in terms of deciding what they should do with Medicare, and maybe they have no idea what all this actually means, send them this video. And if you do that, clearing up confusion is the best way to keep yourself and your family members safe from anything going wrong in the way of Medicare scams and all that kind of stuff. Hopefully keeps yourself from confusion. So until next video, until next time, my name is Joel. Thanks for being here. I'll see you next video.